Welcome to another episode of Medicine Simplified. In this video, we will know about Braxton Hicks contractions, which are also called as false labor pains. Braxton Hicks contractions are sporadic contractions and relaxation of uterine muscles. It is also known as prodromal or false labor pains. Braxton Hicks contractions are body's way of preparing for true labor. Just remember, not every labor contraction is true labor contraction. By the end of the video, you will know the difference between Braxton Hicks contractions and true labor contractions. But they do not indicate that labor has begun or is going to start. BHS starts around 6 weeks gestation, but usually are not felt until second or third trimester of pregnancy. Usually they start at 6th week, but patient will feel contractions during second or third trimesters. These contractions are thought to play a role in toning the uterine muscle in preparation for birth process. So they are referred as practice for labor contractions. They don't result in dilatation of cervix, but may have role in cervical softening. In true labor contraction, we can see cervix dilatation, but in Braxton Hicks contraction, there will be no cervix dilatation. BSC also play a role in promoting blood flow to placenta. They may be uncomfortable, but they are not painful. Feels like mild menstrual cramps. So patient doesn't feel heavy contraction pains. Coming to the etiology, the exact etiology is unknown. Contractions are caused when the muscle fibers in uterus tightens and relax. There are some circumstances that triggers Braxton Hicks contractions, which are stress, dehydration, full bladder, intense work. There are 4 stages in Braxton Hicks contraction. First is relaxed state, in which uterus is soft and relaxed. Second is contraction stage, in which uterus begins to tighten and patient may feel mild tightening or pressure. In third stage, which is peak stage, tightening reaches its peak and typically it is not painful. Fourth stage is after contraction, uterus becomes relaxed. These are 4 stages of Braxton Hicks contractions. These are important differences between Braxton Hicks and true labor contractions. Braxton Hicks contractions are not sign that your body is undergoing labor. In true labor, it is a sign. BHCs happen irregularly and are unpredictable and eventually taper off. But in true labor, it happens regularly, consistently, and do not go away. BHCs last between 15 and 30 seconds, but in true labor contractions, it may last between 30 to 90 seconds and get longer over time. BHCs succeed when you change position or move around, and in true labor contractions, it doesn't succeed when you change position or move around. Don't become more painful or intense over time, but in true labor contraction, it becomes more painful or intense over time. Bates is usually felt only in front of the abdomen, but in true labor, it starts in back and move to front. This is the important difference between Braxton Hicks and labor contraction. Braxton Hicks contraction can be felt only in front of abdomen, but in true labor, it starts in back and move to front. Bates is generally not accompanied by any other symptom, but in true labor, patient will experience other symptoms like water breaking and losing mucus plug. These are important differences between Braxton Hicks and true labor contraction. Coming to the management of BHC, there is no medical treatment for Braxton Hicks contractions because there is no serious complication related to BHCs. But there are some actions to ease BHC, which include changing position or activity level. If woman has been very active, tell her to lie down. Or if woman has been sitting for extended time, tell her to go for a walk. And second one is relaxation. Tell her to take a warm bath or to get massage, to read a book or listen to her favorite music, or try to take a nap. And tell the patient to drink lot of water to dehydrate, because dehydration can cause Braxton Hicks contractions. If you like this video, please subscribe to our channel. Thank you.